Hello everyone, welcome back to Radiology Made Easy, your all-time favorite YouTube channel.
Hi, welcome back everyone. Today we are going to start a new series in radiology, that how to approach series. In that series I'm going to describe about approaching chest x-rays, approaching abdominal x-rays and approaching bone x-rays. So those are important things in radiology before identifying any pathologies. The first topic in our approach series is how to approach chest x-rays. So this is the frontal chest radiograph of scately mature female patient. First of all, identification of the patient is important. So this is the name of the patient, this is the age, this is the gender, this is the BHT number, and this is the X-ray number. So those are 5 things in identification of the patient. Next thing is the projection, whether it's a posterior or anterior, that means PA. That's where we project radiation posterior to anterior of the body, or AP projection. And usually we take the standard projection is posterior anterior in a erect position. Next thing is the side. Here you can see they have marked the side, left side. So it's important identifying the side, because there will be patient who has dextrocardia and situs inversus. So next thing is exposure, adequate exposure of the body and adequate exposure of radiation. Those are the 2 points in exposure. Here you can see there's exposure of the patient. You can see the first rib, you can see, so adequately exposed, and also you can see the costophrenic angles, first rib and the costophrenic angles you can see. So it is adequately exposed. Usually you have to take C7 to L1 level, L1, or you can D12 level. You have to exposed, and lung epices should be seen clearly, and costophrenic angles should be clearly seen. Next thing is also it's a inspiratory film. You can see posteriorly 10 ribs, but in case 9 to 10 ribs. Yeah, 1 2 3 4 5 6 7 8 9. Yeah, roughly 9 ribs you can see. 9 to 10 you have to see. That means it's adequately inspirated view. That's a good X-ray. And also either 9 posterior ribs, so 9 to 10 posterior ribs, so anteriorly 6 ribs. Here you can see 1 2 3 4 5 6. So it's a adequately exposed film and inspiratory. Next thing is radiation exposure. You have to see the peripheral soft tissues, whether it's overexposed or underexposed. If it is underexposed, this will be whiter. If it is overexposed, this will be darker. Now the technical method seeing the exposure of radiation is the posterior vertebra, posterior lower thoracic vertebra. If they are seen very clearly, that means overexposed film under the cardiac shadow. If they are not seen, that means underexposed film. If they are faintly seen, it's adequately exposed film. So that means they should be seen faintly. So it's a good film. So that finishes the exposure factor. Next thing is the breast shadow. You have to find out. Here you can see the breast shadow. It's important. There are patients with mastectomies, so identifying breast shadow is also an important thing. Then the lines and tubes. Here you can see the trachea. The endotracheal tube usually has 2 lines, and it is located between the T1 to T3 level, or 2 centimeters above the carina. And NG tube also important. It goes like this and will be positioned in the stomach or in the gastric bubble. So usually it has 3 rounded opacities at the terminal end. So that's the NG tube and endotracheal tube. And also ET tube or tracheostomy tube also will be there. It's like rounded ring and goes like this. It's the tracheostomy tube. And also other tubes, intercostal tubes, they come like this, intercostal tubes with double lines, and they have holes. Those are the intercostal tubes. Then you have to check for the lines. Central venous line, usually tip is located in the SVC like this, goes like this, and also pacemakers goes like this, and in the right atrium, pacemakers like this. And also in children, you have to look for umbilical, arterial, and venous catheters. Umbilical venous catheter is like this. This tip is located at the junction between right atrium and IVC, or at the level of diaphragms. And umbilical arterial catheters usually located at D6 to D10 level. Those are the things in children. Then now we are going to start the chest X-ray interpretation proper. So actually you don't need mnemonics to keep in mind those things. The simple thing is you go from central to peripheral. Identify the structures at the center, then go to peripheral. First look at the important thing is trachea. You can see the lucency centrally in the mediastinum, central linear lucency. So lower part is slightly shifted to the right side, and this is the carina, usually located at D4 level, and these are bronchi, right main and left main bronchi. And the different next thing is this is the superior mediastinum. You have to see the widening of the superior mediastinum. There will be masses which cause widening of the superior mediastinum. It's also important. Find out the length of the superior mediastinum or the width of the superior mediastinum. Then next thing is the heart. It's important to find out the position and shape and size of the heart. Position, shape, and size. All those three things are important. Position, shape, and size. And position is usually you have to see the right heart border is 1/3 from the midline, and the left heart border is 2/3 of the midline. So that's the normal position of the heart from the midline. Right heart border 1/3, left heart border 2/3. So the next thing is the size of the heart. The size of the heart you measure from the midline, the sinus process, right. You have to measure the maximum length of the right heart border and the maximum length of the left heart border and maximum diameter of the chest wall. You add these two things, the maximum sizes lengths of the right and left heart border, and divided by the maximum size or diameter of the chest wall. It should be less than 50% in adults and less than 60% in children. So that's the size. This is the normal shape of the heart. You can see. And also the borders of the heart. Right atrium from the right heart border. Yeah, right heart border. Then the inferior border is mainly formed by the right ventricle, partly by left ventricle, and the left heart border formed by left ventricle, and this is the left auricle. So those are the borders. Then the other borders you have to look for. So this is the pulmonary trunk. So this is the SVC border. Medial to that, ascending aorta. This is the aortic knuckle. And also this is the descending thoracic aorta. And here you might see the brachiocephalic trunk, this region. Brachiocephalic vein and the brachiocephalic trunk. Then next thing you have to see is the hyla. This is the left hilum. This is the left hilum, So this is the right hilum, this is the left hilum. The difference between the height of the right and left hilum is about 2 centimeters. This is the normal hilum, so 2 centimeters the distance. Hilar structures are usually pulmonary vessels, artery, vein. You see these are pulmonary arteries mainly, and lymph nodes are also there. So if there's prominence, you have to suspect lymphadenopathies, the pulmonary arterial hypertension like this. So these are normal pulmonary hilar vessels. And this is the interlobar artery, you can see. And now we have to find out the pulmonary vasculature. Here this is the normal pulmonary vasculature. Here, pulmonary vasculature. And now let's talk about the lung parenchyma. This is the lung parenchyma. Periphery there's pleura. You have to look for the pleural thickenings. So horizontal fissure goes like this. Oblique fissures are like that. And you have to see whether there are molutions or pacifications is in the lung parenchyma. So that's the lung parenchyma. And in pneumothorax, lung will be collapsed. Peripheral vascular markings are not there. In pleural effusions, the costophrenic angles will be obliterated. These are cardiophrenic angles. So that's what you have to look for the lung parenchyma. Then next thing is the diaphragms. You can see the diaphragm, right and left hemidiaphragm. The difference between height of right and left hemidiaphragm is about 3 centimeters. Right diaphragm is higher 3 centimeters than left one. The one. So you see right and left hemidiaphragms, their position. Other thing is the gastric air bubble you have to look for. Here you can see gastric air bubble, that's a normal position. It is important in identifying cytic inversions and calicia cardias. We have to find out gastric air bubble and also esophageal atresia in children. It will be absent. The next thing is soft tissues. Yes, you can see the soft tissues here. Whether there are soft tissue swellings. The final thing is bones. Find out the ribs. Here you can see the posterior ribs, these anterior ribs, the clavicle with companion shadow. Sometimes they include the shoulder joint. You can find out shoulder dislocations and joint arthritis. And also the thoracic vertebrae is also important. Pedicles you have to look for, the intervertebral disc spaces you have to look for, and those are the things. So in addition to those I mentioned, you can look for additional lines in the chest radiographs. This is the right paratracheal line. This is the left paratracheal stripe. This is the esophageal stripe. And this is the para-aortic line. So, and these are right paraspinal line and left paraspinal lines. So in mass lesions, there will be swellings of these lines and deviation of the recesses. So this is esophageal recess. So those are the things you have to look for. So that concludes how to approach in chest x-rays. And please subscribe our YouTube channel in how to approach series, and you will get notifications of our new videos. Thank you everyone.
Thanks for watching. Please like and subscribe for more videos like this.